All right, students, one of the other major things that you're going to need to think about before you have a baby, or I suggest you think about it before you have a baby, is how are you going to address potty training? For those of my nursing students, for my nursing students out there, this is something that if you're interested in peds or interested in working with young children, parents are going to be asking you about this. It's also something parents typically complain about. So we're going to spend a little bit of time going in a little bit more detail here. For the most part, I'm going to be discussing two different approaches to potty training. The first one is the Brazelton approach. This has been the typical approach that has been used in terms of how children are to be potty trained in this country. Again, for my nursing students out there, if you're going to be working with a pediatrician, most pediatricians do take the Brazelton approach and recommend Brazelton to their patients. They combine Brazelton with some behavioral techniques. A little bit later on, I'm going to be discussing a slightly different approach, which is a much more traditional way of approaching potty training, in the sense that more people around the world do follow this approach, and it has a much deeper history to it. One of the things that we're going to start off by talking about is the fact that the age to begin potty training has been slowly increasing. In the 1930s, most mothers started potty training their infants around 3 months of age. Now, students usually find this to be really surprising. And the reason why I always start my lecture by pointing this out is that what's very intrinsic in the Brazelton approach is that you don't start potty training till much later, usually 2.5, 3 years old, 30 months, between 30 and 36 months. One of the reasons why potty training was started so early or done so early is because mothers used cloth diapers, and the longer that child was not potty trained, the longer they had to wash diapers. So if you've got a lot of motivation on the part of the mother, you can do potty training much earlier. And historically, it had been done much earlier. By 1999, Dr. Brazelton, most of his recommendations had been taken in by the APA and used by the APA as the standard for how to potty train children. And Dr. Brazelton does recommend that potty training begin usually around the age of 3. About a third of children are still wearing diapers around their 3rd birthday. The crux of Dr. Brazelton's approach focuses on the idea of readiness. And this is a method of toilet training most commonly used. It relies on watching for signs that the child is physically, intellectually, and psychologically, quote unquote, ready to be potty trained. Some people call it a child-centered approach or a child-led approach. But really what a parent does is they put diapers on the infant. They keep the diapers on the infant until they see some sort of signs that indicate to that parent, okay, now I can start potty training. Things like talking about the potty, showing an interest in others using the bathroom, that they have an ability to listen or to follow directions. And at that point, you're going to go ahead and you're going to initiate potty training. And you do that through successive approximations. So what successive approximations are, it's a behavioral technique where you are reinforcing small behaviors in order to get to the large behavior. And only when a child is very comfortable with the small initial step do you then turn around and move to the next step. So for example, the parent introduces the potty. Just brings it into the house and introduces it to the child and says to the child, okay, one day, this is where you're going to go to the bathroom. And when the child starts to sit on it or feels comfortable with it or asks questions about it, then you'd go to the next step, which is you just have them sit on it. And then you go to the next step, which maybe they might go to the bathroom in it. And at every step, you're reinforcing. And a reinforcement is very typically used, again, that's a behavioral technique. If you remember back to your lecture on theories, and typical reinforcements, stickers, M&Ms. I had one student, she gave popsicles or fudgesicles to her son. The idea here, though, is that children are never punished, and they're never kind of forced through these successive approximations, these very small steps. Now, you have to be very careful here when you're using this approach and you're using a behavioral approach, because sometimes what can happen is children come to understand, well, if I ask to sit on the potty, that's one way for me to get a treat, or that's one way for me to get a reward. So they'll say things like potty, and you put them on the potty, and this happened to my student, and so she puts her son on the potty, and she gives him the fudgesicle, and he's sitting there eating his fudgesicle and not doing anything, and finally she says, you don't really have to go potty, do you? And he says, oh no, it's coming. It's coming. So what can happen here is that they train you. So you have to be very careful that you never give the reinforcement until after you see the behavior that you're looking for, which is they go to the bathroom in the potty. Parents can get very frustrated with this. It's very challenging to train a toddler. They're on the go. They're on the move. They don't like to sit still. They're very independent. They can be very contrary. The other thing about training at this age, training at 30 months, 32 months, 36 months, is that you've already instilled a behavior that it's acceptable for them to go to the bathroom on themselves. And that's a very hard habit to break. So you have to exercise a lot of patience. When I hear other parents talk about using punishment with this, it really bothers me, because essentially what a parent has done, if they've chosen that they're going to use disposable diapers and they are going to utilize that and they are not going to potty train until past 30 months, what they've decided to do is essentially train a child that it is acceptable to go to the bathroom in the diaper. And now what you're doing is you're untraining them. Right? You're untraining them from that habit, and you're training them into a new habit, and you have to exercise a lot of patience here. You cannot expect that they're going to wear diapers when it's convenient for you, and then turn around and stop wearing diapers when it's convenient for you. You have to understand that as a toddler, they want to insert their independence, and some kids pick it up very quickly, 2 to 3 days to maybe 2 or 3 weeks. Some toddlers, it can take months and months and months. And sometimes toddlers will even purposefully not go to the bathroom in the potty in order to assert their independence. And you have to expect that this can happen. So another method that is used is elimination communication, also known as diaper-free baby. Now this is the method that I used to potty train my own daughter. This is not a method that is typically discussed in a pediatric office. Not a lot of pediatricians know about this method. Most pediatricians recommend Brazelton with a combination of behavioral techniques. And most pediatricians do potty train their own children in that method, in that framework. Now, I use elimination communication primarily because I'm Italian. I chose to use cloth diapers. My mother used this technique on us as babies. She showed me how to use it on my daughter. This is I would call an old school technique. It is also a technique that is most widely used across cultures. Elimination communication is a practice in which a caregiver uses timing, signals, cues, and intuition to address an infant's need to eliminate. One of the things you see here in this little picture, that is a little baby. He's probably, I'm going to guess, maybe about 2 months old. And yes, that is him peeing in the sink. Basically, caregivers respond to babies' bodily needs and enable them to urinate and defecate in an appropriate place. They don't go in the diaper. The emphasis here is on communication. What you're doing is you're watching your infant, and when your infant gives a cue that they need to go to the bathroom, you take the diaper off. Even and some ECers don't even use diaper. They go completely diaper free, and you bring them either to the toilet or you bring them to the sink or you have a potty waiting there, and you help them, enable them to go to the bathroom. They do not go to the bathroom on themselves. This is based on the idea of instinct. It works on that idea of instinct, that babies are born not wanting to defecate on themselves and that they signal their need. Very similar to a denning instinct that we see in puppies. Puppies will yelp if they need to go to the bathroom, and their mothers usher them out of the den and they go to the bathroom outside of the den. Dogs, if they are crated, do not want to go to the bathroom in their crate. That's their little den, that's their little house. This is the same sort of thing, that we are not hardwired to want to go to the bathroom on ourselves. And I'll tell you, I remember with my daughter, one of the things that she would do is she'd have a different cry. You come to identify the cry that they have when they want to nurse. And then they have a little bit of a different cry when they want to go to the bathroom. And I remember I would hear that cry and I would think, oh, she's going to go to the bathroom. And boom, and then I would change her. Now, I myself started ECing my daughter when she was 3 months old. Most ECers start between 3 and 5 months, where they listen for the cry of their baby, they take them and they hang them over the toilet, or they'll hang them over a sink, or hang them over a potty. Just like this woman is holding her baby with the baby's back against their chest. They hold their little legs and they give them the signal. The signal is psh, 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 psh. Everybody uses the same signal. Some people go pss, 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 pss. It makes them go to the bathroom. What happened in my situation is at 3 months, my mother said to me, we're done. No more washing all these diapers. And I said, well, what do you want to do? And she said, we're going to take her to the bathroom. Anybody that's ever changed a diaper on a baby knows that you take the diaper off, and in a couple minutes, if you don't hurry, they're going to go to the bathroom again. Takes the diaper off my daughter, brings her to the bathroom, gives her the signal, and she peed in the sink. And that was it. We were done. My daughter at 12 months was down. At 9 months, completely stopped pooping in her diaper. She only pooped in the potty. She started sitting on the potty at 5.5 months. At 9 months, every poop was in the potty. No more poopy diapers at 9 months. At 12 months, we were down to 9 to 11 dirty diapers a week. At 18 months, we were down to 2 to 5 dirty diapers a week. And at 20 months, she was potty trained. No more dirty diapers. And at 24 months, no more diapers at night. No more diapers at night. So, way ahead of the curve. Ingrid Bauer is a name that is commonly associated with this technique, and she actually coined the term elimination communication. She was inspired by the traditional practices of diaperless baby care in less industrialized countries and hunter-gatherer cultures. One of the things that Ingrid Bauer noticed, and she is an anthropologist, archaeologist, is that in this country we use paper diapers, but most of the other of mothers in the rest of the world don't have access to that. They need to figure out how to keep this baby from constantly pooping and peeing on them. So they have to use cues, they have to use timing, they have to use signals, and they have to figure out how to get them to the bathroom or get them to the latrine, or else all you're going to be doing is washing diapers all day long or having this infant just constantly having accidents on you. And they figure it out. The Maori of New Zealand actually start very, very shortly after birth. Usually about 2, 3, 4 weeks after birth, they will start ECing. And like I said, in Italian culture, we usually start around 3, 4 months old. So elimination communication or diaper-free baby, it's usually done without diapers. It can be done with cloth. One of the things that we know about mamas that choose to use cloth is that not only is it better for the environment, not only is it better for baby, you've got a mama that's super motivated to get that baby potty trained. It can be done full-time, part-time, or just occasionally. I did not work for the first 7 months of my daughter's life, so I did it full-time, and then after that, we switched to part-time. I did hire a nanny who was familiar with e-seeing, and when I told her, she was from Colombia, and when I told her, okay, this is how we potty train, she thought that was just great. She was like, that's what we do too, and it all just fell right into place. So what are some of the benefits as opposed to taking a much more traditional? It reduces the risk of diaper rash. I never personally ever had an issue with diaper rash. They never wear a wet diaper. Keeps any sorts of chemicals off a baby's skin. One of the things that you do need to realize with paper diapers is that is a chemical in there to create all that absorbency. You're really on top of their elimination. So if they are having an allergic reaction or their poop looks funny, you're aware of it. Reduces the risk of urinary tract infections. Reduces the risk of constipation. My daughter never had a problem with constipation. It's not unusual for infants or children, toddlers that are traditionally potty trained to go through periods of constipation because they want to hold it in. They want to act independent. Eliminates unexplained fussiness and colic. You are helping them to go to the bathroom, and you are encouraging them to go to the bathroom. And this is a big one. It reduces the risk of bedwetting in older children. One of the things that people that practice this argue is that the muscles that we use to control holding it in and letting it go, if children are not encouraged to use those muscles, they don't use them. And when you don't use it, you lose it. So one of the things that can happen, even when children are potty trained, toddlers are potty trained at 30 months, 36 months, they will still have accidents at night. And they can have those accidents well into being 4 and even 5 years old. You never see that in an EC baby. You never see that because they are using those muscles from the get-go. And they're practicing that all the time. I'll tell you, my pediatrician, she's also Italian. I picked her because I knew she came from a traditional household. And when I told her how I was potty training my daughter, the first thing she said was, oh, well, I came from a family of 8 children, and I remember my mom potty training my sibs that way. She goes, that's an old way of potty training. And I said, yes. And she didn't say anything, and she said, well, they still don't have enough muscle control, enough control of those muscles to be able to hold their urine or their poop for long periods of time. And I said, okay. And what was so funny is when I took my daughter in for her 20-month checkup, and she didn't have a diaper on, the pediatrician said, I knew it was going to work. I knew it was going to work because I saw it work. And so this is kind of the challenge with practicing EC, is that getting your physician on board, getting your sitter on board can be hard. So I've got this little guy over here with his split pants. This is very typical in ECing cultures. Once they start walking, the diaper comes off. You put on the split pants, you show them where the potties are, they walk themselves over there, and they go in the potty. No more need for diaper. And my mom would tell the story about she would see the toddlers would wear the split pants. The only time you'd ever put a diaper on a child over 12 months is either at night or if you were going to go out for a long period of time. Other than that, you just put the split pants on them and they go in their potties in the house.